So now we're going to do a thumb spica splint. So in the case of a clinical scaphoid where we're worried about that fracture but it's not quite positive on x-ray, we use a temporary splint which we call a thumb spica splint. Now it's very similar to the volar slab, only difference is we're running it down the radial side of the arm. So the position of function for these splints, thumb down in the pincer position and wrist cocked back slightly into the neutral position there. Now, I always take the splint and I measure how far along the thumb, and there's always overlap. So what we do for that is once again remove the product from the felt. And we cut a bit of a angle on one side. And I'll show you why in a second. Back roll your edges to the bottom. Here the problem is these can be very abrasive, and these edges, if not round down, can dig in the arm. Once again, we measure our lengths. We're still good. We like to leave the tip of the fingernail out, so we can do recap and also just keep a visual eye on how tight that tensor is. But it's not such an issue as it would be with a cast because you're able to remove it. Once again, give your felt a pull. On the side that you trimmed, you cut it back. You don't want that bulk within the thumb. Grab a tensor bandage. I like a 2-inch for thumb spicas, unless it's a big guy. You can use a 3. So that the part that you've angled goes on the top, and that allows the lower half to come around and encapsulate that thumb. And this is where you mold before you apply the actual tensor bandage. Give it a little bit of a tweak. Come up, grab that thumb, give it a nice spin. Some people like to bring the tensor bandage down here, some people don't. I tend to like there just for control of any swelling. You can use 2 2-inch bandages if you need to. And the same thing applies if it's too tight after 20 minutes. You tell the patient that they can loosen this and then readjust it. So I'll grab that second tensor. And always go past your margins to hold the edges down straight. When you're putting clips on, just to let you know, if you're going to send somebody for x-rays or radiology, try and keep the clips for the tensor as far away from this fracture site as possible, just so that radiology guys don't have a problem with that interfering. Most of it's radiotranslucent, but sometimes they're not. You get the patient to put it into the pincer position to the tip, and this allows it to have a functional wrist, yet still support. And we do this for a few reasons. Number one, you're allowed to oppose your index finger, but it also opens up the snuff box, so it brings your thumb down and takes the pressure off your scaphoid injury. This is a thumb spica splint, or some people call it a radial gutter splint.